So facial contouring, in terms of the non-invasive options that are out there, has become a really important part of rejuvenating the face. Years ago, lifts in a sense, I call it a two-dimensional lift. You're kind of just pulling and tightening the tissue. But nowadays, we realize that aging occurs in the three-dimensional space. So we find that volume loss, laxity, all of these things are occurring simultaneously. So you do have to contour. You have to build up that volume loss both in the muscle and bone. But contouring really has gone that extra step. And I've found that with regard to certain asymmetries that exist, because none of us have a perfectly symmetric face, and the volume loss that occurs over time, the contouring options with the fillers and injectables has become fantastic. Interestingly, there are various things about the face that will give away the age. I call them the telltale signs of aging. So in a consultation, I'll typically sit back and assess the whole look. And for a lot of folks, there will be certain things that draw your attention. And those are the bigger things that I kind of look at. The big picture is what we want to improve. And as I step back, a lot of times the neck is the area, the neck and the jawline, that draw the attention first. In rejuvenating those areas, there are various techniques. As far as the jawline area, sometimes nowadays with lasers or fillers, and fillers primarily, you can really smooth that area. And I've had some folks that come in and say, gosh, you know, I wish I had more time to get through the recovery, but I can't take that time off of work. I have too much going on in my social life. I just want to keep going. And at that point, we'll do the fillers, contour, build your own body's collagen, get it looking beautiful. And over time, some of them have had as good a result with the filler as they would have with a lift. It's been around for quite a while. Probably people remember the days of good old collagen, but the advances have been such that the products, the longevity, the potential for allergic reactions, all those things have become so much better in terms of how these products are bioengineered in a lab and not animal-derived. They are so much easier to work with in my hands as I look at myself as an artist in a lot of ways. Years ago, when I was finishing my training, mid-face lifting with surgery was the norm. Now you can contour the mid-face with fillers in such a beautiful way and accommodate for the asymmetries that we all have in such a precise manner that fillers are an excellent non-invasive option. They last quite a bit longer. The olden day collagen used to be about 3 months, which is kind of unacceptable if you're going through all the effort and cost of doing these things. So nowadays, the fillers, the hyaluronic acid fillers, will last anywhere between 6 and 12 months. Some will last longer, depending on how quickly the individual metabolizes it. And then some of the others will last even longer. The hydroxyapatite, the Radiesse, various things there, can last 15 months. In fact, some things like Sculptra and Voluma claim to last up to 2 years. A lot of the newer fillers are immediate result type products. It's pretty cool. You get to literally see the results as we go. In fact, for most of my patients, I have them hang onto the mirror as we're injecting so that they're comfortable with the process.
It was concave,
It
hollowed
was.
out.
I can see a difference already.
And my personal approach is a more conservative one so that we're not getting too aggressive and creating a caricature of my patients. We want a good, solid, natural look, something that looks rejuvenated and not overdone. You can certainly come in, have the injections done. Similarly, we'll use a little bit of topical anesthetic. We'll go ahead and inject thereafter, and the results are beautiful. But with the filler, there is going to be a little bit more swelling. The potential for bruising is also a little bit higher, so you just have to be prepared for that. Those that are a little bit more conservative may not want to go right back to work. Others have gone back to work and been fine with it.